Children's mental health is become very important to me over the years for, I guess, a myriad of reasons. As a parent of 5 daughters, and 2 of our daughters have special health care needs from very early on. We had a young daughter diagnosed with type 2 diabetes when she was only 2 years old. And a year later, we had another daughter diagnosed with profound hearing loss. And so we dealt with those 2 issues for quite a long time. When Annie committed suicide, it was at that time I found out it's an epidemic. Young people who should be at the height of their excitement about life are afraid, or have been ill, or they've been ill a long time and have no help for it, or they're angry. There's several levels to what needs to be done, and it's beyond user-friendly language or people-friendly language. You have to really believe in that language. You have to really believe that everyone has to have help at some time doing something. You don't have to be labeled mentally ill. You don't have to be labeled ill. You just are needing help to cope with a certain situation, whether that's with medication or not with medication, with talk. When you're trying to talk to family and friends or even coworkers, it becomes something different. You're sort of noticing there's people may not want to hear it. It's something frightening for them. Their children are okay. They're doing okay. They don't really want to hear about somebody who's not, unless they're a very unique person. The people that know the best are people who are going through it with me, but that plate's already so full, so sometimes it's hard for them to continue on with their load and then take on mine. So the whole experience ends up being very isolating all the way around. One of the things, unfortunately, that bothers my other daughters is I'll talk about Annie's death to a store clerk. They'll comment me on my necklace, and I'll say, yes, my daughter's ashes are in here, and the other piece of this heart is with her ashes in Colorado. Well, that makes my daughter insane. It's like, oh my gosh, Mom, that is too much information. But yet, many times I've had that store clerk say, oh my gosh, I lost a daughter too 10 years ago. Or they say nothing, and I mean, Annie's more real for me for another minute. It's okay. I do see things such as being asked for my opinion on how should we make this move. Should we include more parents? Should we include more persons with disabilities? Should we include this or that? What is your opinion? And so I'm being asked to participate now. Even being a part of this video is an awareness of that. It's an awareness of both of those things. And I haven't been able to do that in the past 3 years, but this is something I felt I had to do. So it is slow going, and there's always an uphill battle when it comes to lesser and lesser funds and so on, but some things are more important than the dollar, and sometimes you just have to figure out how can we do it. And you may find that it actually doesn't cost anything.